project we've been working on for 2 years, and during the course of those 2 years we have been out talking to people across the county. We've stood outside supermarkets, we've been to sheltered housing accommodation for older people, we've been to care homes, day centres, and met with as many people who are either receiving services provided by adult services at the moment, or who may receive services at some time or another. And what we wanted to find out from people is what was important to them, what services they really valued, what services they didn't particularly like, and where we could be making improvements. And one of the big things that people told us, 2 things I want to highlight. One is that most people want to be as independent for as long as possible. I'm sure that's not a surprise. And very few people want to go into a care home. And most people want to be able to manage and sort themselves out. So if they have a problem, they want to be able to access whatever services they need as easily as possible. So taking into account what people have said, and some of the other key things that people told us, is they found that there are too many organisations, and so they often don't know where to go for help. Different organisations providing slightly different services, so people were often left, particularly when they were in a crisis, not knowing where to turn for that important help that they need. Lots of money wasted from duplication. So I know of a sheltered housing scheme in South Wiltshire, for example, where there are 5 different companies going in twice a day to provide some personal care services to people living in that sheltered housing scheme. In addition to that, there's also housing staff that are based in that sheltered housing scheme also providing care and support to people. So clearly with that sort of duplication, we're talking about care workers driving to that sheltered housing scheme and several different workers coming from all over the county to visit that scheme. And one of the things that we want to address with these new services is to minimise that sort of wastage, to make sure we can spend all the resources that we have actually on frontline services. So we don't want to waste money on people driving all over the county. One of the things that we heard a lot about, particularly from older people living on their own, is they were worried about what happened to them or could happen to them in the middle of the night if they had a fall or if they had an anxiety. They didn't necessarily need an ambulance, but they had a concern in the middle of the night. So that was an issue that a lot of people talked to us about. 2 other things that I want to highlight, and one of the bits that we are particularly proud of with this piece of work is one of the services that people told us were important is what's called that little bit of help. So it might be mowing the lawn or cutting the hedges or replacing a light bulb. Just those really little things that can sometimes be the final straw that means that somebody says, actually, I really can't manage in my home anymore, I'm really going to have to go into care. And at the moment, it is very difficult to get those sort of services, and part of what we want to address with the new service, which I'm going to tell you about, will be that little bit of help. And finally, the bit about loneliness and isolation. I'm sure we all know people that are living in very isolated environments. They may not see anybody, perhaps apart from their care worker, for 20 minutes a day, or they may not see anybody at all from 1 week to the next. And I know there's lots of really good stuff going on throughout Wiltshire, volunteers, carers, voluntary organisations that are trying to fill that gap. And time and again we heard from people how very lonely and isolated they are. And we know from evidence and research that 40% of people over 65 suffer from depression. And equally, there's a very clear link between depression and falls and admissions to hospital. And that whole cycle of deterioration, which is also one of the things that we want to address. Just a bit about the range of services that are available in Malmesbury, and just to highlight how many different organisations there are around for people who may need some help and support. So at the moment in Malmesbury there are 8 different organisations providing domiciliary care, personal care or home care, the sort of helping somebody out of bed, get dressed, the very sort of personal care tasks. There's one organisation providing shelter support, and I think they've already been mentioned, so that's Wesley, who provides sheltered housing but also provide housing support, so often staff going into those sheltered housing schemes keeping an eye on people. 5 different organisations delivering a variety of equipment, and the sort of equipment we're talking about is things like continence products, specialist chairs for people who've got pressure care problems, grab rails, the sort of practical equipment that we can can be put into people's homes that enable people to be able to manage their homes better, and hundreds of voluntary and community organisations. What we've been working on and is now coming to fruition is a range of new services. We're commissioning and just about to start a new care and support service that will bring together all the sort of little bit of help with domiciliary care, with housing related support, and that all those services will be provided by one organisation. Alongside that, and to respond to the people who were worrying about having a crisis or a problem in the middle of the night, we are going to roll out telecare and crisis response service, and I'll talk a bit more about that in a minute. We're going to bring together all the equipment services into one provider, and we're going to do something about improving the way in which people can access help and support and advice when they need it. So just a bit about the Help to Live at Home service and what will be happening in Malmesbury. We went through a really rigorous selection process, and having invited all organisations to bid for these contracts. And the winner of the care and support contract in the Malmesbury area is Leonard Cheshire. They will be taking over the care and support for the 41 people that are currently receiving care funded by the council. We will be working with Leonard Cheshire over the next 7 years to really develop their services, and we will be looking to Leonard Cheshire to be part of the community in which they're working. We want to see their staff based in Malmesbury, connected with the community organisations and the local groups, so that they're able to bring together the people receiving care with the wide range of services that are available. We want to see particularly older people who are currently very housebound at the moment being able to get out and about a bit more. And we think that by one organisation such as Leonard Cheshire, working with local groups, will be able to do that. Just a bit about, and I don't know how many people know, as you get older, your life can get very reduced down. And often an older person, maybe who is very frail, maybe got out of bed by a care agency and then put into a chair where they will spend the day until somebody from the care agency comes back out to see who they need and to put them to bed. This new contract, and we will be looking to Leonard Cheshire to do this, will be changing that. And we will be talking to older people about actually what you want with your life. We have to be able to offer people more than sitting in their chairs all day. So we'll be working with Leonard Cheshire to develop those services. Leonard Cheshire will also be able to do a little bit of help. We want them to be out in the community, not just helping people supported by social services or people with very high level needs, but also keeping an eye on other people who are potentially vulnerable in the community. Maybe because they're isolated, maybe because they've had a small problem, an admission to hospital. We want Leonard Cheshire to be out in the community, keeping an eye on those people as well. Running exercise classes, falls prevention, doing all that stuff that keeps people healthy and well and part of their community. And part of that, and again, I don't know whether people are aware, often people that provide care workers are employed on very basic hourly rates. They often don't have good terms and conditions, which often means that there's a very high turnover of staff in these professions. We'll be saying to organisations such as Leonard Cheshire, we'll be looking to see those staff being given salaries, being given real terms and conditions that make it an attractive profession to draw particularly young people and others into those, so that we can build a workforce who are really proud to deliver excellent services. Just a bit about what's happening now before I move on to telecare. We're currently going through that changing process. We are currently contacting people who are funded by the council and telling them about changing care agencies. There is a lot of upheaval and change, and we are managing that by talking very carefully to the people who are receiving care and explaining to them about what's happening. But just in case you are here, people who are in that situation, we've been very public about there is a helpline, so anybody who is concerned, who's had a letter to say their care may change, we urge them to ring the helpline, and we will do what we can to reassure them. Just moving on, and I'll try to speed up a bit. And alongside that, and the bit about people worrying about what happens in the middle of the night, I don't know how many people, it telecare is a whole range of things. It's a word to describe things like pendants, pull cords, detectors that can tell whether somebody's had a fall, whether the fridge doors are open, what their blood pressure is. Telecare is a huge range of things. We want to be encouraging particularly older people, or alternatively people living on their own who feel vulnerable, to think about having telecare. But there's no point in having a piece of kit that triggers an alarm unless there is a response. So alongside the telecare, we will be putting in place a call centre based in Chippenham and joined up with the health service. And that call centre will respond to an alarm that has been triggered, and will send out either an ambulance, a doctor, or a social care worker who's able to put somebody back in bed if that's what's required, reassure somebody in the middle of the night. And this is a really significant service, and one we are just in the middle of designing. I'm working with a large group of older people trying to get the service right so it meets their requirements. So it's early days at the moment, but we're looking for it to start in January. And it will be available to the whole population of Wiltshire, either people buying into the service or the council-supported customers will be able to access the service. And I think that the little bit of help bit as part of that service will be, if people want it, they'll be ringing people up, checking that they're okay, reminding them to take their medication or to eat their meal. And we found this from a small pilot that we've been operating, actually people with very high levels of dementia are able to manage with the support that telecare and the response service can give them. Just two other aspects which I have touched on already. The new equipment service will start in November, so an example of how that will work is that when somebody comes out of hospital, one organisation will be able to come out, deliver the equipment, make the necessary adaptations to their home, and in the longer term we'll also be able to offer the practical sort of handy person services to people living in their own homes, so the plumbing, the fixing, the curtain rail, all of those sort of things. This new organisation that will be starting in November, we haven't yet appointed them, will be available again to people to purchase themselves. So if somebody wants to get some professional advice about what sort of equipment's available to help them, they'll be able to go to this organisation, which will have retail outlets, so people can go try out equipment and can buy the equipment from them. That will be happening in the next year. So just a quick whiz through of what we believe these services will deliver. One service of care, a response service able to respond to people 24 hours a day. A little bit of help to help people who don't need a great deal of support, but what they need is really important. One equipment service and the same service available to the whole population, which we believe will deliver greater independence. More people will be able to sort themselves out and make their own arrangements if they know where to get that help. And from our point of view, we will be able to reduce the costs of those services, because instead of care workers from all different agencies driving all over the county, or equipment providers, 4 or 5 different companies delivering equipment at the same time, those savings we will be able to take and invest in the services. And alongside that, we'll be able to commission this new response service, which will be a first for the council.